Hi, I'm Dr. Emily Landon from the University of Chicago Medicine. I'm a specialist in infectious diseases and the executive medical director for our infection prevention and control program here at the University of Chicago. It makes sense that the public health emergency is going to end. I mean, this isn't exactly an emergency like it was back in 2020. But that said, just because the public health emergency is ending doesn't mean that COVID is over. COVID is still killing about 300 Americans every week. And while it probably isn't going to be you, it's going to be someone. And it's important that we do the things we need to do to help prevent COVID from spreading as much as we can while we're living our regular lives. Like it or not, we're in this time period where you kind of have to take care of yourself when it comes to preventing COVID. It's the you do you strategy. And now with the public health emergency ending, we're also switching to kind of you do you paying for COVID. And that might be tough for some individuals. But it's important to remember that most insurance is still going to pay for COVID testing when you're sick. And Paxlovid should be covered by most insurances pretty easily. And if you're high risk for COVID, bad outcomes, for example, if you're over the age of 65 or if you have an immunocompromising condition like I do, then it's really important that every single time you get sick, you get tested for COVID, even if it's a little bit harder to get that test now than it was before, and you get that Paxlovid if you need it. If you're healthy, young, and not really worried about COVID, I get it. But there are a lot of us in this world that need you to be a little bit more careful. So if you're sick, wear a mask so that you can protect people like me. People who are high risk don't always look high risk. So wear your mask and get tested if you can. Unfortunately, living with COVID isn't the same as just going back to 2019. So please remember that this infection is here to stay, and that means we're going to have to change some things. Don't let it get you down. Just take the steps you need to take. And if you're sick, keep that mask on.